Hi, this is Dr. Tarek Adra at Kinetics 365. We're here to discuss headaches, very common issue. If severe, becomes a migraine. However, the factors that are involved in headaches are what's somewhat mysterious for a lot of my patients that I see, so I'm here to clarify them. There are four major causes typically that contribute to headaches. The first one typically is environment, hormones, structure, body frame, muscle tension, all that stuff, and chemistry, foods, and or medications or drugs. How do we know it's the environment? Typically, if you think about it, you're always in contact with what's around you. So either you're allergic to pollen, or you might actually, your sinus pockets might not be adjusting to the changes, the sudden changes in barometric pressure. Like if you live in California, the temperature changes like 20, 30 degrees from morning to evening. So what happens in that case, the sinus pockets here and here can expand and retract too quickly, causing pressure. And if you're sensitive and you have other factors involved, it'll trigger a headache. That needs to be addressed. Second, the structure. Structure is the body frame, muscles, bones. That is caused by habits. So if I'm sitting down on the computer all day, I'm gonna put tension on my neck. Those muscles and joints around my neck will eventually start to have knots. Those knots can cause pain to refer somewhere else. We call these trigger points because when you push on them, they trigger pain somewhere else. Usually that somewhere else is your head. Muscles like this guy in the front, the upper trapezius, the jaw muscles, when you bite and you're stressed, you tense up. All of those, when tense enough for long enough, will send pain to your head, causing a headache. The chemical stuff, the food, these are classics. Like people's like, I went to have some food and then because of maybe additives like MSG in there, it triggers a headache. I have red wine, but I don't have the headache when I have white wine. That means you're allergic to something in the red wine. All of that changes the chemistry in a way where your immune system gets activated, causing a headache. The fourth one is the hormones. Typically that's more common in women. Usually you'll notice your headache get worse around ovulation, mid-cycle, or at the beginning of the cycle or the period. Normally those changes occur between progesterone and estrogen, the two main hormones in women, and those sudden changes may cause a triggering headache. Now, the interesting thing is, of course, you're going to sit down and observe, when do my headaches get worse? The good news is that out of these four, there's three of them that are somewhat manipulated, can be manipulated. The hormone one is a little tough, so we're going to skip that one. But the other three we could do something about. And if we do, you may not actually be as affected with the hormone if that's what you're getting. As far as environment is concerned, we have to make sure the sinuses are always as clear as possible by using sinus clearing saline solutions or possibly certain vitamins and herbs like quercetin can help. Second, as far as the structure, of course, you have to change your habits. If you sit in a bad position, you're going to keep tensing your muscles. If you sleep in a bad position, you keep tensing your muscles. We want to change that. We also can use manipulation, local creams. Magnesium is very important on that one. All of these help with structural type headaches. Then we have the chemistry. That's easy to avoid because you're like, whenever I have blah food, I get that. You have to skip that food, unfortunately. So you switch to tequila maybe. The fourth one is the hormones. Check with your gynecologist to see if there's something to be done on that one. But like I said earlier, if you fix the other three, very few headaches can stand on one leg. So good luck. Try to use this information to your advantage. See if you can start observing and get something out of it.